The College of Podiatry is the academic authority for podiatry and chiropody in the UK, and it's also a charity dedicated to foot health research, education and public awareness. The college is the leading UK expert in preventative care, diagnosis and the treatment of problems affecting the feet, ankles and also lower limbs.
The impact of diabetes and the numbers of people being diagnosed are increasing on a daily basis. It's estimated that 400 people were diagnosed with diabetes today and 850,000 people are diabetic but they don't yet know it, which is an extraordinary number. That with the 3 million people who are expected to be living with diabetes at the moment, this is a huge area that's ever increasing costs on the National Health Service. The estimated costs of caring for people with diabetes at the clinical end is 9.8 billion, 3 billion of which is to do with Footcare, which is a staggering amount of money. As podiatrists and as part of the College of Podiatry, we're here to show that simple preventative measures from Footcare all the way through to good, timely intervention is incredibly important at making sure that people with diabetes live full lives without impairment from their life and their limb. The Impact of Diabetes report was really instrumental in showing just how much money is currently being spent on those living with diabetes, and it looked at the amputation rates with an estimated 100 cases per week being undertaken for those with diabetes, which is a staggering number, and not least for those individuals concerned. There's an estimated £250 million being spent on diabetes and 3 billion of the National Health Service clinical budget on those with diabetic and foot problems. So these are significant numbers that need to be sorted out commissioning, especially when these numbers are set only to increase by 2035 with an estimated increase up to 17% of the NHS budget. The encouraging thing to take away from this report on the huge amount of sums that are being spent on NHS Footcare and the devastation that's occurring is that prevention in the form of simple, effective Footcare regimes can have such an impact on the health and the wealth of the individuals concerned. Prevention is key, having access to good podiatry care when it's necessary and open lines of communication, but it's very cheap, very simple and very effective. Hello, thank you Teresa for inviting us to your home and talking about the all-important diabetic feet and foot care. I know you live very well with diabetes. Would you like to tell us how you were diagnosed?
I was diagnosed in August 2009. So I was displaying some of the classic symptoms of type 2 diabetes. But from that stage of diagnosis, I took the bull by the horns and thought I'm going to try and manage this and just have it as part of my life rather than have the condition actually dominate my life. But it is something you have to address on a daily basis because it's going to be with you forever.
So what did you put into place that you hadn't done the day before the diagnosis?
In terms of what you eat, looking at labels, being very aware of sugar levels. Nothing too dramatic, but it's something you're going to be able to live with and cope with every day.
And did you lose weight in the process?
I have, which has been a benefit. I've come down 2 or 3 dress sizes. I can now enjoy shopping for clothes. I look better, I feel better, and it has had a benefit in that respect.
And the health professionals that helped you on this path so far, who are they and what kind of help have they given you?
I've had fantastic support from my doctor and the diabetic nurse at the practice, and I access my podiatrist on a regular basis as well. Now both my podiatrist and my diabetic nurse do lots of foot checks for me, which I access every opportunity, because they're looking at your feet, they're testing out your feet and just to see that everything's in tip-top condition.
And do you have any foot problems?
I've been very lucky so far and not had any problems at all.
And do you understand the dangers that can happen to feet with those living with diabetes?
It can be very frightening when you first learn about what some of the side effects can be, but by having a daily routine of just checking your feet and looking after them, I think it can help prevent a lot of the problems that can occur.
That's fantastic, because it's non-healing lesions that we're worried about. It's when the diabetes is impeding healing, and that's when we need to really step in, because we don't want you to move to the next level of having real problems with your feet, and that's what we're here for. So very simply, what we recommend you to do is wash your feet, look after your feet, apply a good foot cream. The cream I recommend is CCS because it's got high urea content, and then you apply it. Now my tip is always to apply it quite thickly onto your feet. Obviously we're using your hands here. One of the great things to do with this type of cream is to really rub it in and then leave a good thick layer like that, have a cup of tea, have a chat, and it's really wonderful. Once that's done, once you've left it there, just get a towel and then you just wipe off the excess. and what's left with is the urea's opened up all the moisturising requirements of your feet, and all the goodness can go in, and that's a fantastic way of really looking after the skin and feet.
Excellent.
So get a nice thick layer, leave it for a bit, and then wipe it off. Stunning results.
Fabulous.
One thing I want to show you, and to remind people that if they're living on their own, it's harder to get to your feet sometimes. You can use a mirror for your feet.
Good idea.
Because with diabetes, we do know that it can have quite severe impact on your circulation and, more importantly, your sensation. You tend to lose it from the toes upwards. So you can have hurt your foot without knowing. So sometimes using a hand mirror to visually inspect your feet. And that's the part of the simple foot care advice that's so important. The word is visual inspection. It's not just guessing that your feet are okay. And that's, again, part of the reason for you applying a good foot cream. Definitely part of checking your feet, and if you can't check them yourself, check with a mirror, and if you can't get someone to help you, then be checking with your diabetic nurse or your podiatrist.
That's good advice, thank you.
Thank you.
The UK is currently spending nearly £3 billion on patients with diabetes and their foot problems, and it's really crucial that we try and reduce that spend. And the way we do that is by making sure that we coordinate the care with all the right practitioners, making sure that the patient is able to manage themselves, and that's really, really key, that the patient's able to do that. But they can't do it by themselves. They require our help, telling them what the problems are, what signs to look for, helping them with the assessment, and making sure that they follow good health and good foot care throughout their life. Patients with diabetes are often told they're low risk. What that means is that they haven't yet got the complications of the diabetic foot, which is really important, but we want to keep them that way. And that will involve regular podiatry visits, intervention from the GP and the practice nurse on an annual basis, but also the patient can do a lot for themselves, maintaining good toenail care, maintaining good skin hydration, and that's a really key issue, that we maintain that the skin is moist and supple and it doesn't lose its elasticity that we can see in diabetes. So a very good product for ensuring skin hydration is really important. The stark reality is that in the UK we're performing nearly 100 lower limb amputations per week for diabetes. There is a reality issue in that we know that one amputation on one side often leads to a second amputation on the other foot within 2 years. And 5 years after that, we see the mortality rate of diabetic patients increasing substantially. It's very important that we intervene at an early stage to manage those patients so they never enter that cascade of events.
My advice to people with diabetes is please look after your feet. We only get one pair and it's important to keep them in great condition. Look after your skin, wash daily, moisturise, keep the skin nice and supple so that it stretches properly, and wear good footwear. Now, good footwear are shoes that fit. And okay, it's fine if you're going out looking stunning for an evening to wear a nice high heel, but the rest of the time please wear something that's low-heeled, plenty of toe room, that doesn't put pressure on any of the toes.
With the implications of diabetes and how it can affect feet, it's often forgotten that patients sometimes will think that they're low risk, and I've often heard people say to me that they only have a little bit of diabetes, and that really belies the seriousness of what could befall them if complications come and circumstances arise that just give that magic and quite sinister sometimes combination. So it's really important that we convey to these individuals that simple and effective foot care is so important, but it must be carried out on a daily basis, and we often find that someone's been to a wedding or something and it's that one pair of shoes that's caused the destruction. So being vigilant at all times, implementing simple foot care regimes can really make such a difference.